medical history is negative, and the vision was 6/6 in both eyes. Anterior segment normal. Next, please. This is her left eye. As you see, there is a vitreous hemorrhage. Nothing unusual in the picture apart from the vitreous hemorrhage. Next. In the other eye, it's probably not clear for you, but this is a localized superior hematogenous retinal detachment, and there's a small hole in this area. So basically, what you are going to think about the left eye, what's the cause of the vitreous hemorrhage in the left eye? Probably the first thing would come in mind, it will be a PVD. So I was looking for a break everywhere, and there was nothing. Next. This is the inferior view of her left eye. I'm lucky to have the Optos in my clinic in Jannah, so we can scan the whole retina. You see there is a suspicious area here where it was covered by the hemorrhage. So we waited for this hemorrhage to settle down, and meanwhile I did laser for the other eye. This is after the clearance of the vitreous hemorrhage. You see there is exudation here surrounding the mass, localized inferior-temporally. Next slide. This is her right eye, and I did a complete 360 laser surrounding the localized hematogenous retinal detachment, and she was doing very well. Next. This is the fundus autofluorescence. The reason why I did fundus autofluorescence, because such a mass could be a melanoma, and as you know, a melanoma will have high autofluorescence signal in fundus autofluorescence. Actually, she did a B scan, but I don't have the image. It is a retinal mass, it's not a choroidal mass. Next. This is her fluorescein image. As you see, there is a vascularized lesion, localized inferiorly, elevated. It's a mass, it's a pinkish color. Next. Increasing in the leak from the mass. Next. This is the superior sector of the same eye. Next. If you look at the temporal area, there are areas of non-perfusion and perivascular leakage. Next, even in the right eye, here, I don't know if you see it, there are areas of ischemia with a perivascular leakage. So what is this perivascular leakage? It is actually a case of vasculitis. So, what is this tumor? Actually, it is a vasoproliferative tumor. I faced like 3 cases in 3 months, which is pretty much rare. One of them was retinitis pigmentosa, and the other one, Dr. Zaid did cryo, and she was very well, but unfortunately we lost follow-up. And this one, it is a case of vasculitis, so you know the vasoproliferative tumor is either idiopathic, which is the majority of cases, or associated with intermediate uveitis, or maybe a part of retinitis pigmentosa or Cott's disease. The patient was scheduled for cryo, and I sent her to my colleague, Dr. Zaid. Unfortunately, she decided to go outside. She went to Iran, and I don't know what they did to her, because she came to me on the follow-up. The lesion was the same, and she did. They gave me anesthesia, and they did some sort of procedure. I don't know what's the procedure, and then she disappeared, unfortunately. So I don't know what's going on and what they did. But my point of this case is that you should not always shift your mind in certain diagnoses. For example, from the start, we were just thinking this is a PVD and waiting for clearance, looking for a break, while there is a mass lurking behind the hemorrhage down. So this is my take-home message in this case. Any question? Thanks.